Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
Well, hello there, and welcome to Community Conversations. I'd like to start out today by recognizing that this is the week of our Veterans Day celebrations, and thank the many men and women who over the years have offered up their service, and to their families who have recognized and supported these individuals during their time of service to our great nation. And so, again, I say thank you, and we will be celebrating with recognition of how this great nation affords health care. Whether you believe that it's a human right or not, those of us that are in the healthcare business truly want to eliminate all the barriers to having the best healthcare that you can. And so today I've got as my guest Colette Hyde, who is a certified application counselor. And that's a very special role that requires education and due diligence to help people find the best plan in the affordable healthcare marketplace. So welcome, Colette.
Thank you for having me here.
Feeling very patriotic today.
I love your scarf. I love it.
Thank you. Thank you. So this is an annual thing that we've done since the Affordable Care Act was put in place some years ago. I know that there is discussion this week at the highest level of court. The Supreme Court is reviewing it again. I believe this is the 3rd time it's come before them. But even if there were to be a change, that would not happen immediately.
That is correct. The Supreme Court actually heard oral arguments yesterday, November 10th, concerning the Affordable Care Act and whether or not it's constitutional, in the sense that in 2017, Congress actually voted to zero down the individual penalty for the individual mandate, which meant that if individuals did not have health insurance before that, they were actually charged a penalty when they filed their taxes on the IRS. In 2017, Congress said, we're going to zero down that penalty so that we're not holding people who can least afford health insurance, let alone least afford to pay this penalty. So they zeroed it out. They didn't eliminate it, but they zeroed it down. And yesterday, the Supreme Court actually heard oral arguments concerning whether or not that is legal to have the individual mandate with a zeroed out fine. And it sounded like at least the Supreme Court justices had some common sense there in saying that, well, we understand the intent was to make it easier for people and not to completely eliminate the Affordable Care Act. We won't have an answer until June of this year. No, of next year, of 2021, actually. But the reality is, it is the law of the land right now. We are in open enrollment currently. Open enrollment started on November 1st, and we are currently mid-enrollment and will continue until December 15th. So Treasure Coast Community Health has a cadre of CAC enrollment specialists who are there to assist individuals to navigate the Affordable Care Act and healthcare.gov.
So let me ask you this. There is some confusion about what a CAC is allowed to do or what the intent is. We're not insurance brokers.
That is correct.
We accept insurances, all insurances for the most part, including those that are on the marketplace. But you are not allowed to recommend a particular type of insurance. Is that correct?
That is correct.
Okay.
Our advice is more so to guide them through the process and help them understand the different insurance policies that are available to them. Here in Indian River County, there is a limited number of insurance providers. Blue Cross is one, and Better is a third, a second, and there is a third provider also. But it is more so to educate the consumer on how they use medical insurance and which plan would be best for them based on their prescriptions, based on the type of doctors they see, and based on how much they can afford to pay. There is, even though the Affordable Care Act does have an advanced premium tax credit or an APTC that goes with it, the individual person does have some money in the game here. They are paying for their health care, and it's important for them to understand what their monthly premiums are versus what their annual deductible will be, and how we try to educate them on what's the best plan for them, not which insurance company is best for them.
Yeah, when we first started looking at insurances as an employer, I was amazed, honestly, at how many plans each insurance type, whether it was United Healthcare or Blue Cross or Cigna or Aetna, how many different varieties of options they gave us for our employees. It was mind-boggling.
It is.
Subtle little things like a $50 deductible for this versus a $40, but on the other side, for medicines or specialty care or something else, all of these different things that you could evaluate once you narrowed it down to affordability in the first place.
Absolutely. And that's one of the things that we try to at least educate the consumer when they come to us on what would be best for them. I had a family in my office the other day, a mother and her daughter, and they were both adult women who were looking to purchase insurance through the healthcare.gov. And the mother was, I can afford this. This is what I would like in my plan. The daughter was a little bit, well, my budget is a little bit less and I really can't afford that. But tell me which one would be best for me. And I said, well, I can't tell you which one would be best, but I can educate you on what the different choices are. And I think that's where the consumer really feels as though the assistance of a certified application counselor comes into play.
And this is a free service that's offered.
It is free, absolutely.
Okay.
It is free. And typically from the beginning of November until December, that's the majority of my job is to assist individuals. But I'm happy to do it because it really makes me feel as though I'm helping them with some good choices.
For many folks, this is their first opportunity really to purchase insurance.
Yes.
And so what are the income requirements or caps or limitations that might be associated with being able to do the marketplace insurance sign up?
Well, anyone can apply through the marketplace for insurance. Based on where your income is, it's typically 138% to about 185%. Those individuals qualify for what's called cost sharing. So where the federal government actually kicks in some additional funds to help offset the cost, and will put them into one of the 4 different tier categories of insurance. We have a bronze plan, a silver plan, a gold, and a platinum.
And that's based on
income
rather than their choice.
That is correct.
Okay.
So those individuals who receive that cost-sharing component will be encouraged to select a silver plan because that's where the federal government has deemed that those plans are the best plan for those individuals. Those cost-sharings, additional advanced premium tax credits help those individuals to get a very good plan for less money than they could buy in the open market.
So they're not expected to make a full payment like like a regular insurance,
Correct.
But rather the advanced tax credit applies against the monthly premium, so
Correct.
they pay the difference.
Correct.
Okay.
And then in addition to that, for that category of individuals from 138% to 185%, actually receive some additional benefits because they are deemed the ones who need it the most.
Okay.
But anywhere from 138 to 400% of federal poverty level individuals can benefit from purchasing insurance through the Affordable Care Act.
So can you break this down into terms most of us can relate to? We don't carry around federal poverty level tables in our head. If you were a single individual, what type of income would you be looking at?
We're looking at about $14,000 is the cutoff, the initial cutoff.
Okay.
And all the way up to 400% would be somewhere around $50,000. I don't have the exact number in front of me, but that's typically where individuals fall.
For an individual.
For an
and then,
individual,
of course,
not a family. That's an individual.
And this is a federal program.
That is correct.
So I'm going to make the assumption, and you tell me if I'm correct or not, that those below 138% are those that in other states at least would be eligible for Medicaid coverage.
That is correct. But in the state of Florida, some of those individuals also qualify for the Affordable Care Act because Florida did not expand Medicaid. So since we are a non-expansion state, some of those individuals will receive the Affordable Care Act insurance.
So folks that have not reached 14,000 or expect to reach 14,000 over this next year should still make an appointment to come in and discuss it.
They should absolutely come in because the reality is they will not know unless they actually go through the application process. Now, you can do that online by yourself and go to healthcare.gov and register. All you need is your email address and a password, and then they'll validate that you are who you claim to be. And then from that point, you can do your own application online. It's easier if you come to a certified application counselor because we know what they're asking, what those questions are. But typically what they're asking for you to do is to guesstimate what your income will be for 2021, because right now that's what we're applying for. If someone wants coverage effective January 1st, they must have their application in by December 15th.
Okay, so we're going to take a short break and think about that for a moment or three while we're listening to our sponsors. And then we'll come back and we'll go back through this a little bit and add some additional information because this is very timely and very pertinent for a number of people in our county who find themselves without insurance this year. Thank you.
10, 9, 8.
Why did the countdown stop? Because it's the countdown to Buzz TV channel 1098, Comcast Xfinity, and it's here. Local content for Sebastian Vero and Fort Pierce. Tune in for local info, happenings, and fun, including all the great Planet Vero TV shows from 8 to 10 a.m. and p.m. Dial in channel 1098 for Buzz TV on your Comcast Xfinity box and discover what the buzz is all about.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
At the Habitat Restore in Vero Beach, we applaud America's spirit. We proudly open our doors every day, Monday through Saturday from 10 a.m. to 6 p.m. on U.S. Highway 1 in Vero Beach, just north of 45th Street. Shoppers can always find gently used merchandise at great prices. You'll find values in home furnishings, appliances, home decor, building materials, electronics, and so much more. Treasure hunters flock to our Indian River County Habitat Restore to discover fresh merchandise out on the floor daily. Remember, every purchase helps to build 1 in every 3 Habitat homes in Indian River County. Thanks to the generosity of those in our community who provide a steady flow of donations, our trucks can come to you and pick up gently used or even brand new goods. Or we have a drop-off point at our warehouse on location behind our store. Shop the Habitat Restore, the store that builds houses. The Habitat Restore on U.S. Highway 1 in Vero Beach, just north of 45th Street, is open to the public.
New Vision Eye Center provides world-class eye care on the Treasure Coast. To tell you more, here's Dr. Robert Reinauer.
Many patients are under the impression that floaters in your eyes are a condition that you have to just accept. Floaters can spontaneously appear as part of the natural aging process, and they disrupt your clear vision. Some have had a laser treatment that does not remove the floaters. At New Vision Eye Center, we provide the latest techniques in the permanent removal of floaters in your eyes.
Dr. Robert Reinauer with New Vision Eye Center exclusively performs this proven procedure to remove annoying floaters in the eyes, providing world-class care for macular degeneration, diabetic retinopathy, and retinal surgery. For an appointment, call 772-257-8700 or visit newvisioneyecenter.com. Make the move to retinal specialist Dr. Robert Reinauer at New Vision Eye Center in Vero Beach.
And welcome back to Community Conversations. This is your host, Vicki Soule of Treasure Coast Community Health, where we provide primary medical, dental, behavioral health, pharmacy, substance use disorder, and a host of other services. And today we're going to talk about one of those services that is free of charge and is very timely because it is something that happens for a very short time during the month of November and part of December. So to help us understand this special occasion better, I've asked Colette Hyde to join us. So if you're just joining us now, you're going to hear all about the Affordable Care Act signups.
Yes. So we're currently, as I said before, we're currently in the middle of open enrollment with the Affordable Care Act. It runs from November 1st through December 15th. For any individual who wants to have health insurance effective January 1st, they need to sign up by December 15th.
Once that time passes?
Once that time passes, it needs to be, you will have to qualify for what's called a special enrollment period in order to get health care, which means at that point, let's say you lost your health care through an employer-provided health care. You moved into the community. There was a death of a spouse. You adopted a child. You got married. You had a child. Those all generate a special enrollment period. But the reality is, if you miss that December 15th deadline, you'll have to wait an entire year before you would qualify for insurance again.
And those special enrollment periods, are they time limited as well?
They are time limited. Typically, from the date of the event, you have a 60-day window in which to apply and get coverage. And the same deadlines apply to that. If you apply by the 15th of the month, you will have coverage by the first of the next month.
Oh, that's good.
Yeah.
But keeping track of the dates is the important part.
Keeping track of the dates is really important. Okay. Absolutely.
So tell us about the types of individuals that are looking for insurance by income, by perhaps circumstances now, because we're all very concerned about what has happened in this last year with COVID and businesses closing. A lot of people were laid off, but then called back. Mm-hmm. So if they have health insurance through their employer, even though this might appear to be cheaper, they're not eligible.
They're
Is that
precluded, correct?
Okay.
If they have health insurance through their employer, they are precluded from applying for the Affordable Care Act. They won't qualify.
Even if it has a very high deductible?
Even if it has a very high deductible, but it has to be what's considered affordable.
Okay.
So that's the caveat there, and it's almost a 10% affordability. If it doesn't cost more than, I think it's 9.78% of your gross household income in order for it to be considered affordable. Most employer-based insurances are considered affordable because they've had to run through the dynamics of that to make sure that it did qualify as affordable.
Okay. But for those folks who truly have lost their insurance coverage, will this coverage cover specialty and hospitals and pharmacy? And
Absolutely.
Okay.
There are 4 different tiers. There's a bronze plan, which is typically considered a catastrophic plan that has a very high deductible and has limited coverage, but it does have some medical coverage in it. That pays at about that pays at a 60% rate. Then the silver plan pays at a 70% rate, gold at an 80% rate, and platinum reimburses at a 90% rate. But with each category, you pay more for each category and line of service. It's like if you decide to, and I don't mean to disparage any car dealership in the world, but if you decide to, like my dad was he was a Chevy man, and he says, "Oh, I can't afford a Cadillac. It's the same car."
Yeah.
And I was like, "Dad, it's not the same car." But considering that thought process, that's basically the way the insurance plans are written. Also, the platinum plans are considered the Cadillac line of insurance.
Okay. If someone has a chronic care condition, then are you saying that the recommendation for silver might not be enough?
It depends on where their household income is. A silver plan, if they qualify for cost sharing, actually may reimburse up to a 92%
of their expenses
based on their household income. So it really depends. A silver plan is as effective and as good as a platinum plan if there's cost sharing involved in it. So it really depends. I mean, when this program was designed, they did really do a lot of research and thought into helping the individuals in America who could not afford health care. We've got a lot of part-time people who work 2 jobs. They may be working more than 40 hours a week, but only working part-time at an employer, which neither offer them health care. So this is a way for them to actually get health care and really qualify for some decent coverage.
And that's very, very important because anything could happen to anyone,
Absolutely.
as we have all figured out a little more deeply this past year,
Yes.
Despite all of our great intentions. And certainly as a primary health care home, we encourage people to stay up routinely with their preventative care. You know, the old saying, an ounce of prevention's worth a pound of cure. Well, if you can't feel that you can afford the prevention, then that's where the insurance portion kicks in.
And that's what we see a great deal of. I see a great deal, especially during open enrollment. I see a lot of people who come in and go, you know, I need to get health care effective January. I was just diagnosed with diabetes or with a heart condition, and I've never been able to pull it together, whether financially or emotionally or whatever the commitment issue was to acquire health care. But now I realize that it's an important part of me keeping and being alive.
Yeah.
So,
so pre-existing conditions don't count.
They don't count with the Affordable Care Act. They were eliminated with the Affordable Care Act. And I think that's really important.
It is indeed. There's a lot of young people that are madly in love and despite COVID have downsized or eliminated the big fancy weddings. Babies may be in their future. We just had a birth within our own staff member this morning. Congratulations, Maritza, on a beautiful baby girl named Victoria.
Wow.
Totally unplanned, though.
Yes.
So those are the kinds of things, again, that you review with them in terms of each of their considerations going forward, possibilities,
Absolutely.
actual facts, because it sounds pretty complicated.
Well, there are required healthcare benefits that must be in a plan to be considered affordable and a quality plan. So pregnancy is one of them. Even though it may not affect a man or a male in the household, it does affect the female. You never know. I mean, when that situation may come into play.
That's where it's found out.
Chronic conditions are also covered. I mean, it's really important that there's nothing that's not covered.
Okay. So if individuals want to make an appointment with a certified application counselor, what should they do, Colette?
There are 2 phone numbers to call. You can either call 772-646-6408 or 772-571-1989. Both will come to me.
Okay.
And I will make sure. I may not answer the phone immediately like right now or in the radio station, but I will call you back and set an appointment. I have appointments on the books right now as long as December 2nd. So if individuals want an appointment, they need to call now and set that time. I tried to be extremely accommodating. All of us are available during the day, early afternoon, evenings to accommodate everyone's work schedule because I understand that people do work. And if there's a need, we also have weekend appointments. So the reality is that if you think that you want to sign up for the Affordable Care Act, or you're even just curious as to what it looks like, call us. We'll walk you through it and we'll help you decide whether or not this is something that you want to do.
That's wonderful. And although they could use our general phone line, 257-8224, that line is also used by many, many people with a variety of needs. So repeat your numbers one more time, please.
It's 772-646-6408 or 772-571-1989.
Well, thank you so much for being with us today. We are streaming this on Facebook, so if you couldn't grab a pencil and paper fast enough, see us on Facebook.
That's right.
Thanks for being here.
Thank you.